stopping to recognize today as the National Day of Prayer. Congress has set aside this day and designated as one to turn to God in prayer and meditation. It's especially poignant to have this National Day of Prayer today in the midst of a national crisis and pandemic, when faith plays such an important part in so many people's lives, in the midst of uncertainty and loss of life and loss of job and loss of peace in many ways. The need for prayer to remain steadfast continues. And Maria and I are lifting up our state and our nation, recognizing and remembering that God is sovereign through peril and prosperity and everywhere in between. And we also lift up prayers of gratitude for Tennesseans that we have the honor and privilege to serve, but Tennesseans that are serving one another and that will come together and have come together in unique ways in the midst of this pandemic. We are thankful truly for that today. In addition to National Day of Prayer, oftentimes in this country there are weeks that recognize professionals that are serving across this country, and this week it is Correctional Officer Week, it is National Nurses Week, and it is National Teachers Week. Interesting, all three of those fall in the same week. Those are tremendously important professions in this state. We recognize our correctional officers, professionals who serve daily in our jails and in our prisons and our correctional facilities, particularly through this COVID-19 pandemic, have had unique challenges, and we're grateful for their work all across Tennessee. We certainly today, like we have weeks on end through this pandemic, been grateful for nurses and healthcare workers, nurses who put themselves, their lives on the line, serving the sick in the midst of this COVID-19 effort, tireless efforts to serve. We recognize them and the unique role they play, especially in this country right now. And we also recognize this week our Tennessee teachers. You know, it is a very unique time for them as well. Children are out of the classroom, but I'll tell you what, teachers are working. They are working as hard or harder than ever before, and we want to thank them and recognize them for their continued work. You may have heard me tell the story about my grandson who was sitting on a Zoom call with his teacher. He goes to a public school here in Davidson County, and I realized that teacher has to do a Zoom call for every single kid in his class, day after day after day. These teachers are working, and we recognize and thank them for the efforts they're making. Our COVID-19 case count today is 14,096 confirmed cases in Tennessee. It's roughly a 1% increase over yesterday's numbers. There were more than 9,000 tests associated with that number on that 24-hour period. 6,783 have recovered. And sadly, we have lost 237 Tennesseans to COVID-19. During our brief today, I want to outline the future of our increased testing efforts, more about what our Economic Recovery Group is doing to support Tennessee businesses who are taking the Tennessee Pledge, and we want to talk about Department of Labor and Workforce and unemployment claims. Commissioner McCord will give a brief report regarding those, where we are on unemployment. Testing. We're quickly approaching 250,000 Tennesseans being tested for COVID-19 in the state. It's a milestone. It's a testament to the power of the private sector in our state, partnering with the state to provide access and increasing access to increasing number of Tennesseans every day. We tested 2% of our population in April. We are aiming to significantly improve that testing number in May, as President Trump and the federal and the administration encourages and is supporting states in their efforts to test more and more of the population. That is actually how we will know how this virus is acting in our community. It's a part of the combination of things that we've got to do, including social distancing that will allow us to continue to operate and open our businesses in a safe way. Remember, testing is available at all of our rural health clinics in every single one of our counties, 5 days a week, free testing. If you're going back to work, get a test. If you have a symptom, get a test. When in doubt, get a test. We need Tennesseans to engage in the process of increased testing so we can understand even more how it is that we can minimize the spread so people can continue to work and get the economy moving again. This month we're going to focus especially on targeted populations. We are testing every member and every staff member, every resident and every staff member in our long-term care facilities. By the end of this next week, we will have tested every inmate in every state prison in this state. We are working with, Dr. Piercy, by the way, will make more comments about the prison testing. We are working specifically to target minority populations. We're working with organizations that have large numbers of large membership with minority populations, but we're also working with community leaders in Memphis, Nashville, and Chattanooga to strategize testing efforts and events in low-income urban communities, particularly vulnerable populations living in high-density residential settings. The local leaders in those cities have done tremendous work toward that effort. We want to support that work, and we'll be doing some targeted, high-value testing in those areas as well. The goal is to just make sure that every Tennessean has access to free testing, and we remove as many barriers as possible while we move forward. By the way, the Tennessee National Guard has plans to test 10,000 of their own in this next month. Our Economic Recovery Group has completed the first round of guidance for Tennessee businesses, from construction to close contact, as they start to adopt safe operating procedures and adopt the Tennessee Pledge. Parts of our state are starting to reopen in new ways, and that will encourage people to get more out and about. The federal government's allowing parts of the Great Smoky Mountains National Park to reopen this weekend, and we anticipate visitors. And when we get visitors like that, we just want to remind Tennesseans that social distancing is what keeps the virus from spreading from one person to another. We cannot let up on our commitment to hand washing, to staying home when sick, to staying away from groups of 10 or more social gatherings, from being in close contact or close proximity with people that we don't have to. Social distancing works. It's the reason that we're in a position to be able to open up our economy and start moving around. Keep that in mind. Personal responsibility is what will keep this going. Commissioner Ezell, by the way, will be on the ground in East Tennessee tomorrow to work directly with stakeholders and that part of the region as they prepare for the reopening of the park and visitors coming into that area. We also want folks to remember that free, reusable, washable cloth masks are available at every state health department, so Tennesseans can get access to those. Wearing a mask in public settings where others are around is a part of the practices that we need to engage in going forward. We want to make these supplies accessible. Aside from free masks at health departments, we've also given a resource for thermometers for businesses. We actually, the demand for those was so great, we ran out of those quickly. We had 17,000. They were actually for sale through a vendor, but it shows a couple things. It shows how readily Tennessee businesses are adopting these principles, but it also reminds us that we want to be a partner with those businesses. We will continue to try and source and provide information for where businesses can get the right kinds of materials and supplies they need to open safely. tnpledge.com. Before we move to reports about Q&A, I want to make one particular comment about mental health. You know, in the midst of crisis and fear and anxiety and loss and struggle, in the midst of all of that, mental health challenges surface in new ways and in greater ways, or they resurface in many times in people's lives. We just want people to know that our Department of Mental Health and Substance Abuse Services has a crisis hotline 24 hours a day, 7 days a week, 855-274-7471, or text TN to 741-741. If you, a loved one, anyone you know, has any reason to believe whatsoever that they need access to mental health services, particularly in a time of crisis, we want to be able to connect you to the resources that you need, and Department of Mental Health and Substance Abuse Services can do just that. So please remember that, remember those numbers, write them down, be in touch with us if you or you know of anyone who needs any help there. General Holmes, Department of Military, will now come and give a brief report and an update.
Thank you, Governor. Our continued efforts are focused on testing, and we continue to do that. We're testing within our present system. We continue to do our rural assessment sites. We're creating opportunities all across the state to test various populations. We're generating ideas to go and take our testing to those high concentration of our citizens and make it easy for them to get tested, and that'll be an ongoing effort. Also, in addition to our COVID response, we also have a mission to provide ready and trained forces to our Department of Army and Department of Air Force. The COVID crisis has affected our training. It has forced us to make shifts and reallocation of training. One of those is the fact that we've had to shift some of our pilot training. So as a coincidence, a lot of our pilots will be catching up on their training next Tuesday on May the 12th, and that just happens to be the last day of National Nurses Week. So we're taking an opportunity, and our opportunity is to take a step back and salute our civilian healthcare providers and healthcare workers who we had the honor and the privilege to work alongside across the state for many weeks now. And we know there are many more in the hospitals and the clinics and things like that we have not had the opportunity to work with. But we're going to consolidate our aircraft, and we're going to make flights all across Tennessee, and we're going to cover as many hospitals and clinics as we possibly can. And our purpose is to take a step back and salute our healthcare workers. Every echelon, every community, every sector. We oftentimes are the beneficiaries of this honor that our citizens give us when we return or deploy overseas, and we're taking this opportunity to take a step back and salute their heroic efforts. This is not meant to be disruptive in any nature, but it is meant to be recognized, because many times these heroic efforts, you become fatigued. You're doing the daily grind of doing great things for our communities, and sometimes you lose perspective of the positive impact that you're having on our state. So this is an opportunity for all of us to take note of these flyovers, take a step back, and salute our healthcare workers all across the state. Thank you.
Thank you, General Holmes. Thanks again to our nurses. Look forward to that flyover. Commissioner McCord, if you would come up, please, and give a brief report on where we are on unemployment in the state.
Thank you, Governor. Just like most of the country, or the rest of the country, we are seeing a sharp decline in initial claims. We're about 30% of where we were at our peak and around April 20th, and so that's good news. We've also been able to complete all the functionality as it relates to the CARES Act and unemployment insurance benefits, so that is all completed as of this week, as of the end of this week. Two areas of focus for us. The first is to make sure that we're working the claims that we have and getting those eligible ones processed to get the benefits out to Tennesseans. We're making increased use of technology to do that, to accelerate that. We're able to do some things this week that we weren't able to do last week even. And along with that focus, we have a focus on getting people back to work, helping them return to work. We're providing guidance for both employers and employees, as well as going and looking at and addressing concerns that we have, workplace safety concerns from our TOSHA group. So those are the things we're doing. Thank you, Governor.
Thank you. Making progress there. Thank you for that. It's the unemployment situation has been devastating for. Dr. Piercy, would you come to give a health report, please?
Thank you, sir. Good afternoon. Our case count again today is 14,096, which is a 1.1% increase over yesterday. We have done just over 236,000 tests, and we are continuing to push that number as high as possible. Just as the governor said, if there's any doubt in your mind whatsoever that you may need a test, we want you to get a test. Speaking of testing, he also referenced the fact that we are doing some targeted, what we call high-yield population testing in the month of May. It won't stop after May, but we're really focusing on that this month. We have committed to testing all inmates and staff in Tennessee prisons this week, and we're almost finished with that. We've gotten about 12,000 inmates done. I believe there's still 3 facilities that have to complete their testing, but that should be done by the end of the weekend or at the very first of next week. The reason that that's important, in addition to, I should also say that nursing home testing has also started. And whereas we are not, the Tennessee Department of Health and the Guard are turning that testing over to facilities, and most of them are doing it on their own, they are also stepping up to the plate and doing that testing. So between the prison testing and the nursing home testing, we're going to have a lot of results coming in over the next several days. And so I want you to keep that in mind as you start to see cases come in. That we expect to find these, and we expect the numbers to go up because we are going out and looking for them. One bit of preliminary good news, I have seen just a few, maybe a couple of thousand results from, early results from our inmate testing, and the positivity rates are very low in the ones that have returned. And so we're hopeful that that trend will continue, but we'll have to have several more days before we know for sure. One other thing that we haven't talked about in a while is our alternative care sites. And General Holmes and Director Sheehan and I, members of Unified Command, started our day in Memphis this morning, and we toured the commercial appeal site where they are finishing up really a 4-week project to stand up a 400-bed hospital. I can't tell you how impressive that work is. It's through the U.S. Army Corps of Engineers, but it's really a team of teams. And it's fascinating to see the round-the-clock work that they're doing there. And as a former hospital administrator and somebody who's practiced in a hospital setting for 20 years now, that's really impressive that they can deliver that kind of care in a facility that was completely office and industrial-based and not at all healthcare. Also, the thing that may be even more impressive than the actual physical space is the community and the health system cooperation in that area, where they have come together and really designed that facility with the patient in mind. And to see that kind of collaboration and teamwork is not only heartwarming, but it's incredibly impactful for Tennesseans. Having said that, every single person on the site hopes we never have to use it. And I know that sounds odd to make an investment that you hope you never have to use, but it's all in the vein of being prepared. And we want to be prepared, and the site in Memphis is the first of several sites that are going to get us to that spot if we ever need it. We want to remind you, we can avoid having to get in that situation. Do your part and stay apart.
Thank you, Dr. Piercy. Thank you all. We'll have questions. We have members of Unified Command Group here with us, as well as Dr. Piercy, and as you saw, Commissioner Holmes, Commissioner Ezell with our Economic Recovery Group is here as well. Before we go to the questions, I just want to thank Tennesseans once again. Thank you for responding in the ways that you've been asked to respond. Thank you for your work by serving one another. Thank you for taking individual responsibility. I implore you to continue down that path. We are in the middle of this, and we need to continue to do the things that we have been doing. As I've said many, many times, we will do everything humanly possible to make sure that we protect the lives of Tennesseans and that we can protect the livelihoods as well. So we can do everything humanly possible, but I remind everyone again, today is National Day of Prayer. And while we will do all we can, I encourage you to ask God to grant us favor, give us wisdom and discernment as we move through this, that He comfort the sick in our midst and those who have lost life in the middle of this, who face fear and anxiety, that He would comfort them as well. So we thank you for what you're doing and for joining with us. Be happy to take questions.
Thank you, Governor. First, we'll go to Jonathan Mattice with the AP. Jonathan, your line is open.
Hey, Governor. Thanks for taking my question.
Yes, sir.
Yesterday, you said that you would no longer be taking the ESA applications while the court case is proceeding. I wonder what changed for you. Did you get some advice that you should not be accepting applications for that while the court has the injunction in place? And where did you get the advice from?
Yeah, actually, we continued to receive the applications, just not to process them. Today, the application process, the deadline ends today. So we didn't promote that, but if applications were coming in, we continued to receive those applications, but not process them.
Thank you.
Mm-hmm.
Next, we'll go to Natalie Allison with the Tennessean. Natalie, your line is open.
Hello, Governor, and this question may also be for Dr. Piercy, but I wanted to talk about this 98% asymptomatic rate that you all have reported from the state prisons. So my question is, first of all, what is the criteria that the state is using to label inmates and staff as asymptomatic? And is that based on what inmates have self-reported? Because they have told some reporters and some advocates that they have been ill with symptoms consistent with COVID. And then how do you all interpret this high asymptomatic rate? So some people are saying this is not a good sign, that as the state reopens, there may be way more people than we expected walking around as carriers. And then other people are saying that this is great news, and it's evidence that way more people than expected have already had it and weren't affected. So what is your interpretation of that data?
So your first question has to do with basically symptom tracking of inmates. And the 98% asymptomatic was in the Trousdale facility. They take or they keep a log of all inmates that either report symptoms or are showing symptoms and keep a very extensive log of those symptoms. By and large, these are self-report and so that the inmates look well and tell staff that they feel well, and so we don't have any reason not to believe them. As far as your comment or your question about the large percentage of asymptomatic cases, it's a very interesting scientific phenomenon, and you've heard me call it a head scratcher, and I continue to reach out to colleagues and infectious disease experts about why we're seeing this nationally in these contained populations. Interestingly, the MMWR, which is a publication out of the CDC, the W in MMWR stands for weekly. They put out a weekly report of sort of hot topics, and this was the one that came out just yesterday about this very high asymptomatic rate. And it appears to be somewhat unique to these contained populations, and that's important because it's going to lend a false sense of security to people if we extrapolate that out to the general population. We do not believe the general population has that high of an asymptomatic rate. What we can't explain yet, because again, this is, I've said it many times, this is a novel or a new virus that we've really just been dealing with for less than 6 months in the world, to our knowledge. And so we don't know everything about it yet, but we don't think the rate of asymptomatic spread is that high in the general population. I've seen reports as low as 25 to 50%. I don't know how accurate that is. We're still trying to track that number. You know, as the governor mentioned earlier, if you think you need a test, get a test. Even if you don't really think you need a test, but you're going back to work, get a test. That's going to help us determine what the asymptomatic or carriage rate is in the general population. But I want to be clear, we do not think it's anywhere close to that high in the general population.
Thank you. And Governor, or maybe someone else can answer this question. On the topic of correctional officers, can you clarify whether officers who have tested positive for coronavirus and are being sent home to isolate are still being paid? Because based on what some of the officers are saying, that's still unclear.
I'll have to clarify that, but my belief is that they are, but I'll have to clarify that.
Next, we'll go to Chris Bungard with WKRN. Chris, your line is open.
Good afternoon, Governor. You brought up recognizing teachers. Do you have a sense yet when and what it will look like when 1 million K through 12 kids begin next school year, and when that might be?
Well, the legislature determines the school year dates, and so they will certainly weigh in on that, and we certainly hope that kids are going back to school in the fall. There are a lot of parents that are hoping that as well, and we know so little about this virus and what it will look like through May and June and July, but we certainly will follow that with great interest, especially because it has such a significant impact on our kids, and we'll be working with local districts as well. But as far as the dates that school will start back, that's a legislative decision.
And if I may follow on that, do you see it, and perhaps you've addressed this in the past, but maybe you can offer an update about whether this will be a local decision or a recommendation from a state level of when, districts will go back and what they will look like?
Yeah.
Whether they'll be remote learning or back in classes?
Yeah, one of the unique things about what we have learned in this process is that we've learned a lot about education and about what's possible and what might be possible in the future. But certainly, local school districts know best what's happening in their communities. But as far as a decision about how a school year will be determined, who will go back when, it's several months down the road. A lot not known about that. So I can't speak to the exact nature of that, the process there. It'll be much like it has been in the past.
Thank you, Governor. We'll be asking the question again in a few weeks, probably.
I bet you will. Thank you.
Next, we'll go to Caleb Perney with WCYB. Caleb, your line is open.
Hey, Governor, I wanted to ask you, as we're ramping up testing, the number of new cases and the number of active cases are going up and are going up. So what metric are you looking at, and what metrics should people look at to know if we're keeping the spread down as businesses reopen?
I think I'm going to let Dr. Piercy answer specifically to that, because we're starting to track cases in a different way, but we are changing our strategy a bit in the way that we are testing. It's not just that we're doing more testing, we're doing more targeted testing, and that really changes the way our positive counts look. Dr. Piercy, you want to comment on that and what that might mean for metrics?
Sure. I mean, we are looking at a list of metrics. I realize that a lot of people get focused on case count. That's certainly one of them, day-over-day growth and the trajectory of that, but many other metrics, including one very important one, which is health system capacity. And if you'll remember, weeks and weeks ago, I know it seems like a lifetime ago, when we first started introducing the term flattening the curve. Flattening the curve was never about eliminating or completely removing the threat of this virus. We know that the threat of the virus is going to be there until we have a vaccine and develop herd immunity. But what flattening the curve is really about, and what all of our efforts are really about, is maintaining our health system capacity and stretching out that curve, therefore it's flatter, so our hospitals can keep up with the demand. So we're looking at several different metrics. That's just two of them. That's not the only two. The other thing that we're doing that is a bit different than what we did at the beginning is we're looking more at specific areas. And not only geographic areas, but population areas, such as prisons and long-term care facilities. and minority populations and other different specific populations that might have a higher risk or be more vulnerable, so we can make sure and target our efforts where they are most needed. On a geographic scale, we took a very wide, broad approach to our initial efforts because this was a new threat to all of us, and so we acted uniformly across the state. Going forward, and what we've already started doing, is looking at this in different regions, metro regions, rural regions, different parts of the state, and I think everyone would agree, not every part of Tennessee is the same. Population density is different, different factors vary from rural to urban, and so we are looking at it in what I have termed a much more surgical approach instead of a shotgun approach. That will help us to not only target where the issues may be, but it will help us to better target our interventions in those places where we don't have to affect areas that might not be as heavily impacted.
And in our region up in Northeast Tennessee, there are 3 nursing homes that are on your list of clusters, but all of those nursing homes had told us that their tests were false positives. I know the Department of Health is looking into that. Is there a widespread issue of false positives?
No, there's not a widespread issue of false positives, but I am aware of the issue you're referencing. I'm aware of a nursing home in Elizabethton that had that issue, and I wouldn't be surprised that a couple of more had that. It's my understanding that early on in this process, they used a lab not associated with the state that had some validity concerns. Those have subsequently been rectified, and we have made those adjustments or are making those adjustments on our website. I know our state epidemiologist was in touch personally with one of those facilities yesterday, and so getting that worked out, I don't consider that a widespread problem at all.
Thank you.
Next, we'll go to Jake Chapman with WRCB. Jake, your line is open.
Gotcha. Hey, Governor. So this is more for just about the National Guard assisting, the Housing Authority in testing. Is there like a ballpark of how many tests that are going to be handed out statewide to, assisted living and all that?
Well, we have a goal. I'll say broadly this, and then I'll let General Holmes talk about the assisted living testing process. There are 70,000 residents and 70,000 staff in long-term care facilities in this state, and we intend for every one of them to be tested. So that's about 150,000. It is 140,000 exactly. We have a goal of testing, moving our testing numbers to about 10,000 a day across the state. We have had days where we've tested 10,000 multiple times, but we want that to be more consistent because we want to be testing a larger portion of our population, and then we're also testing the National Guard to the tune of how many? 12,000 National Guardsmen. Would you like to talk a little further about the specific strategy for nursing homes?
Yes, sir. So we have a plan which is focused on public housing, the large concentration of public housing in all over metropolitan cities. That's going to be an enormous task, but it's a doable task, and it's going to take probably a week and a half. And there's going to be a lot of planning involved because each one of these large housing units are different. So the purpose will be in there to make it as convenient as possible to test all the residents. So that may mean setting up tonnage or something in a portico in the parking area, going to a common area that's frequented by the residents, and make it as convenient as possible. So we have a systematic plan. We'll hit all the big 6 areas. We'll do this deliberately, and it'll be in close coordination with the Metro Health Department and the local officials there. We'll front load all the PPE and test kits. It'll probably take 2 days at each one of these facilities, and there'll be a break in between each one of those as we kind of focus on that. So we'll be doing one of those units at a time, and we'll just continue to chisel away at it until we get all those complete.
Gotcha. And I guess for me, just to follow up on that, do you believe like public housing in those areas that they could be a hot spot for the virus since, like you said, there are a lot of people in a confined area?
I'll take that one. Yes, absolutely. We are actually learning some lessons that have come out of New York City and other very densely populated areas. Obviously, we don't have any places in Tennessee that are as densely populated as New York City, but we do know that crowded housing and housing where people are living in closer quarters, apartment-style living, is associated with higher rates of transmission. That's pretty logical when you think about it. We've already talked today about contained populations, but even in a household, it's just really intuitive to figure out if you have less room to spread out, you're more likely to transmit to one another. And so not only do you have, in housing projects, do you have closer quarters, but you also are dealing with disparities and sometimes other issues, whether it's language barrier or transportation difficulties that put people into mass transit more often in closer contact. There's a lot of nuances in urban populations that could increase the rate of spread, and that's why we are specifically targeting those areas.
Gotcha. Thank you.
Next we'll go to Grace King with WBIR. Grace, your line is open.
Thank you. Good afternoon, Governor. I know you touched a little bit on this earlier, but last weekend we went to Gatlinburg to see how things were going. Not a lot of social distancing, hardly any masks, even on employees. A lot of the shops we saw had some safety precautions, but certainly not all of them. What's your response to that and your message to people who want to come to Tennessee?
I didn't fully understand your question, but I think it was, what is our response to Gatlinburg and some challenges with lots of folks being there and certain businesses responding or not responding? So one of the things that is most important to us is that we get the word out to businesses that they understand what the Tennessee Pledge is and why it is particularly important to protect their employees and their citizens. We know that an area like Gatlinburg will have a lot of visitors from out of Tennessee that may not have been hearing all of our messaging, and it's one of the reasons that we need for our employees to understand it fully. It's the reason that Commissioner Ezell, who heads up our economic recovery group, will be on the ground there, meeting with officials, meeting with business leaders, meeting with stakeholders who all have an interest in making sure that our businesses in that community are operated safely and that people do understand how important this social distancing requirement and effort is. So that is our goal. That's why we're targeting that region. That's why he'll be there tomorrow. That's why we're making a particular effort to work with those businesses to make sure that Tennesseans are safe there.
Would you consider adding a level of enforcement at some point if people continue to show up and not wear masks in public?
You know, people ask a lot about enforcement, and it's really important. First of all, as I've said before, I don't want to start with the premise that people are not going to comply. We think that folks have a vested interest in complying. Certainly businesses do, because Tennesseans want to be safe themselves. They want to go into businesses that they know are safe. So there is a reason for self-enforcement there, but we've also said that, you know, if there is a bad actor or there is someone who's willfully, not willing to engage, then we certainly want to engage with them, have the health department give them education, an understanding of why this really matters, and we want to interact with them if they're not in compliance. But the vast majority of businesses so far in this state have been. We're very encouraged by that, and we want to continue to give them the tools and the information necessary in order for them to provide a safe environment for Tennesseans.
Next, we'll go to Bill Dries with the Daily Memphian. Bill, your line is open.
Governor, over the duration of this pandemic, how much conflict has there been between the concept of doing all you can to protect lives and doing all you can to protect livelihoods. Are there some differences in those two goals?
Well, I think what's most important is that we uphold both. And it's possible to do that. People say it's either or. It really is both and. Recognizing that the safety of our citizens is first and foremost. Public health and the life of a Tennessean has the highest value of all, and our public safety is the utmost concern. But we also know that we can't keep our economy shut down forever. We made important steps to protect the health of Tennesseans, recognizing that we needed to take steps to protect the long-term livelihood of Tennesseans. And so really it has not been the struggle between those two, but the balance there and finding that right balance to navigate our way through a real crisis and pandemic that had very little answers and that we knew very little about, but that we worked really hard to follow data around the health piece of this and the medical side of it, but then also data around the economics and how it would impact Tennesseans. That's been why these have been very difficult decisions, balancing those two as we go forward. But I think we've made the right decisions at the right time for Tennessee.
All right, and I wanted to ask you about the state's nursing home laws. Our county mayor here, Lee Harris, who is a former state senator, has talked about the need to change, he says, to change state laws to make nursing homes more liable for things they should have done but didn't do in this. He says the state laws got too deregulated. What are your thoughts on that? Is there a proposal in order here to change nursing home regulation?
Well, we don't have a current plan to change the way that nursing homes are overseen, but I would like Dr. Piercy to specifically address that because the state does have that authority and oversight of nursing homes through Department of Health.
What I can tell you about nursing homes is that they contain some of our most vulnerable Tennesseans. And I would venture to guess that every single nursing home would tell you that they are in one of the, if not the most regulated industries in the world. They have an incredibly high regulatory burden, but that's really important because their population is vulnerable. And sometimes their population can't speak for themselves or care for themselves. And so our surveyors and investigators and our board are all incredibly focused on making sure these folks stay safe. And so the governor's right, we don't have any intent to change any laws or rules at this time, but I do want to remind you that it is it's very impactful work that we do there, and we continue to do everything we can to protect these vulnerable Tennesseans.
All right, thank you.
Thank you, Bill.
That's all the time we have for questions
All
today.
right.
Governor, if you would like to make a closing statement.
Thanks again, Tennesseans, for doing what it has taken and for continuing to take heart and have hope and move forward, to continue to serve your neighbors, to continue to take care of the elderly, and to continue to do your part to stay apart. Thank you.
All right, and that concludes the presser for this week. Governor Bill Lee saying on Monday that he is not going to make these daily just when there is new information to share. Today he was focusing on what they're doing in the most vulnerable of our populations as they try to control the spread of coronavirus here. And another headline, if you missed it already, Mayor John Cooper here in Nashville saying that phase 1 will start on Monday here in Nashville. We've got all the day's events coming up on News 4 at 4 o'clock in about 15 minutes. Keep it right here on News 4, and we hope to see you then.
We now return to regular programming. Get more updates at WSMV.com and on the WSMV app.